Welcome back to CVM at Sunrise. Now, everybody loses hair. It's normal to lose, the doctor says, about 50 to 100 strands of hair every day. But if you see bald patches or lots of thinning, you actually may be experiencing hair loss, sometimes called alopecia. And this morning we're actually joined by dermatologist Dr. Campbell-Chambers, who is going to tell us all about hair loss and some treatment options that are available. Doc, good morning.
Hi, good morning. Thanks for having me.
You're very welcome. I say 50 to 100 strands of hair, and that doesn't sound like a small number.
It doesn't, but actually the hair grows in different stages. So at any one point, about 85% of your hair is in the actively growing stage, and then some of it is resting, and then it falls out, and the cycle continues.
So it's about normal hair, right? Is expected.
Right, it is expected. What is abnormal is when you get excess shedding of hair, and hair loss can occur in many different patterns, affecting men, women, and children. You can have a picture where the patient complains of generalized thinning of the hair. And there are many, many different causes for this. One of the main causes is hereditary thinning or balding. And we see different patterns in men and women. In men, you tend to see a thinning and recession of the hairline, and then they can also have loss in the center of the scalp. Mm-hmm. And in women, this tends to present as generalized thinning, and it can also present as a widening of the part. Now, there are lots of other causes that people don't realize. Internal things can result in excess shedding of the hair. Mm-hmm. For example, if your body goes through a significant period of stress, let's say a major illness, a major surgery, high fever, pregnancy, crash dieting, low protein intake, months after, you can get this excess shedding of hair. And
wow.
There are a lot of other medical conditions as well, like anemia, which is, iron deficiency anemia in particular, with a low blood count, that can lead to hair loss. Lupus can lead to hair loss. And thyroid disorders, that's a gland in the neck, that can also lead to hair loss.
I've heard a lot of stories.
Sure.
At one point, Naomi Campbell, that's a hot mess. At one point, there was this thing that said you should brush your hair 100 times a day to make it soft and silky and long. Is that recommended? Because I can imagine there's a whole lot of hair in that brush.
Right. I'm glad you bring this point up. No, I don't. We tend not to recommend that because it's a myth that you should actually brush 100 times. Excess brushing can actually lead to increased breakage. So breakage is another common pattern, especially in individuals of African descent that we see. Now, there may be different factors why your hair would break. Rarely, you may have some individuals who are born with a genetic defect where the hair is just weak to begin with. But more commonly, it can result from, here we go. Yes. It can result from the things that we do to our hair. Now, we have to be careful because I personally believe that it's a personal choice, the different things that you want to do, but as a dermatologist, then it's my duty to also give recommendations as what's the proper, way to go about doing these things. So, for example, the chemical treatments. So we know like relaxers, dyes, permanent waves. When these are done improperly, left on too long, done too frequently, or you mix a permanent color with a relaxer at the same time, that's, a no-no. Right. Then this can lead to increased hair breakage. It's recommended that if you're relaxing, you should leave at least 6 to 8 weeks between relaxers. And if you suffer from hair loss from chemical damage, of course, it would be ideal to avoid the chemicals. But if you feel that you want to, then you should stretch this to 8 to 12 weeks apart.
Can scalp issues affect your loss of hair at all?
Certainly. So that can present in different ways. You have certain scalp issues that may cause scarring of the scalp, and then you have certain scalp issues that don't scar the scalp. Why that is significant is that the causes that don't cause scarring tend to be more treatable, and the hair tends to grow back. Once that hair is scarred, once that scalp is scarred, it's the hair root itself is destroyed, so it's going to be difficult for the hair to regrow. So we have to, there are different causes. For example, you may have non-scarring causes like alopecia areata. What that is a condition where your own immune system is attacking the hair root. And so you may present with bald patches, and the scalp in this case tends to be clean and smooth, unlike ringworm, for example, and other causes of scarring where the scalp may have bumps, pus bumps, scaling, redness, and so forth. And then there's a condition called trichotillomania, long word, but it basically means that the individual is actually pulling out their own hair.
Wow.
So there's a psychological aspect to this where there is a constant need to pull the hair and a gratification when the hair is pulled out. So they would also need psychological help.
Let me talk about the help. Not the psychological help, but treatment options.
Sure.
We hear a lot and we see ads all the time for remedying male hair loss.
Right.
Not so much female hair loss. Is one harder to treat, or is it that one is far more frequent than the other?
Okay. Well, as I said, a very frequent cause of hair loss is hereditary hair loss, both in males and females. It just so happened that one of the popular treatments, minoxidil, and you may know it as another brand name, Rogaine, if I may mention, that treatment was initially marketed for men with hair loss, but then it was discovered that women can benefit. So there's actually that product so both women and men can use it. Basically, it comes in different forms. It could be a solution that's applied to the area, or in a foam form that's applied directly where you want it to work. Now, it works for most people, but not everybody may benefit. You have to use it for months to actually, before you see the result. And if you stop using it, you lose the benefit. So it's something that you have to keep up.
Are you serious?
Yeah, it's not a permanent fix. Now, what's exciting too is that you can have it injected. So we're soon going to be offering at Dermatology Solutions a therapy where we inject it directly into the scalp, mesotherapy, the minoxidil. So it's more effective because
so
if you put something,
you'd have to come in and get an injection of Rogaine?
Right, or less frequently, right? But it's all up to the individual. There's some individuals who would live with it. There's some who would want cover-up methods. For those who would want treatment, there are options. There's also a pill that men can take that women can't take because of the hormonal side effects, called finasteride, which is another option for male pattern baldness. And there's this exciting new treatment popularly called the vampire treatment, but I'll explain. But basically, the concept is that you take blood from a patient's arm and it's taken directly into a machine that spins it and separates the component called plasma. And then that is injected directly back into the scalp. This is popular now for facelifts, for facial rejuvenation and stuff now. So it has been shown scientifically that they did a study where they looked at individuals who had this treatment, individuals who had other treatments, and they found overwhelmingly positive results in individuals that used the plasma therapy. So this too we're hoping to bring on board soon.
Oh my gosh, all these developments in medicine. Well,
and there's surgery as well, hair transplant and so on.
If it all results in a full head of hair, then more power to you guys. Great work.
Thank you.
Doc, thanks for the information.
Thank you.
And I know you put your hair, no problem, I know you put your hair through a lot.
A lot.
So I hope you're listening.
And then as soon as I color it and I put in the cream after, like, everything just fall out.
I'd like to mention too, a lot of our practices, like the braiding very tight, the weaving very tight, we have to do these things looser because it causes a traction alopecia, which can cause hair loss as well. So we have to be careful with the methods we use to care for our hair.
Absolutely. Thanks, Dr. We're going to take a break, and when we come back, don't touch that dial. We're going to be talking about bridal week after this break, and we've got two people who know a lot about it. Well, one who knows a whole lot, and Shani Jaja also, who is actually going to be talking to us about the event as well. They're both here, Cara Ann and Shani, and we're talking bridal week when we return.
I do. And do you take this lady for your lawful wife? Yes, I do. I'm getting married.